Okay, so question number 18. I get a lot of questions about calling on healthcare professionals. Is that a place we should go, and how do you approach that?
I happen to have something to say about that. Last week when I was at the company, I met with Dr. Suk Cho, the Chief Science Officer, and most of the day he was spending with 7 primary care physicians from the Dallas-Fort Worth area. These were 7 doctors that were coming as a result of a medical salesperson bringing them to tour the company, because these doctors realized that traditional Western medicine is not doing the trick anymore. These guys prescribe medication for every problem people have, and then they get side effects, so they prescribe more drugs to counter the effects of the side effects. And these are people that have been practicing medicine 20 and 30 years and said, it's not working. Drugs and surgery is not the answer. We truly believe that diet, nutrition, prevention is the way to go. So I saw 7 primary care physicians learning about this and starting to market the Isagenix products and opportunities. So there's absolutely an opportunity for healthcare professionals.
Okay, so just to be clear, we're not going to go out there and say this is something you should do instead of medicine or instead of that.
No.
But it's something they could add.
Okay, let's understand that firstly, the industry of medicine has changed, correct? Healthcare has changed. So doctors are, as business people, looking for alternative streams of income.
Sure.
Are they going to invest in a pizzeria? Are they going to invest in a movie theater? Or would they rather do something in the healthcare profession if possible? So nutrition and wellness and health tends to be close enough related. Now, there are success stories on the Isagenix website. I found one about a doctor, a very prominent doctor in New York. I think he's from New York, NYU, and he's the head of bariatric medicine, and he's got all his patients on these products. You can find that on the Isagenix website. There are enough healthcare professionals with examples and testimonials of how they personally and their patients have benefited from the products, that they are loyal product enthusiasts.
So let me ask you, if somebody was going to go out and talk to a doctor or call them, how would you suggest that they approach it with them?
Okay, well, before I answer that, I want to let you know that the company is now piloting a healthcare professionals program in general, which allows healthcare professionals that, and that means any place by appointment. So so medical doctors, salons and spas, and even health clubs and gyms, because people work with them, the trainers, on an hourly basis. They have a special program that if they agree to this, they can actually buy the product, so they're physically inventorying it, and get a discounted rate on it, so they have a greater margin on it, a greater profit margin.
Sure.
So Isagenix is exploring these opportunities for healthcare professionals because they know that the trend is moving towards nutrition and prevention, so that opportunity exists. Now, on an entrepreneurial level, I'm contacting medical doctors, and I'm saying, Doc, I gotta ask you a question. Is the timing right to look at something in health and wellness that's outside of your specific practice? It's a big enough question that if they say no, okay, appreciate that, you're closed to anything, correct?
Sure.
Okay. Typically they don't say no, they say, what is it? So I'm working on a program in health and wellness. It's expanding both domestically and internationally, specifically into Southeast Asia and Latin America. And I need some help, I need some medical professional, I need some guidance. It's wellness and it's network marketing. Are you familiar with either, and do you want to talk about either? Now, most doctors will tell you they've had less than 3 or 4 hours of nutritional learning in college.
Sure.
So believe it or not, us as lay people, not you because you're not a lay person, but most lay people know more about nutrition than their doctor does. Now, do doctors like to be wrong? No, nobody likes to be wrong. So to say that you've spent the last 20 or 30 years of your career on one end of a disease that is turning out to be not the best for everybody, that prevention is better, they don't want to be wrong. But many doctors are open to learning that nutrition and wellness is beyond what's the word I'm looking for? Beyond repute. It's got to be a part of their wellness program, right? People have to be practicing preventative medicine. And why shouldn't the doctors be educating their patients and providing them with the solutions? They write prescriptions for drugs. Why can't they make a suggestion for your nutritional needs? Every time I go to the doctor in the past and he said, lose weight, I say, how? He said, figure it out. Well, now a doctor has a solution, how to help people figure it out. Sure. And many doctors do want to transition out of that rat race into something a little bit more calm, reliable, and home-based.